Federal budget cuts to Medicaid are creating concerns that hospitals in Arizona might be forced to close or otherwise delay care for more than 2 million Arizonans that rely on Medicaid. Joining us now is Brittany Kaufman. She's CEO of the Health System Alliance of Arizona. Good to have you here. Thanks for joining us.
Yeah, thank you for having me.
All right, the cuts in the reconciliation budget. Give me your initial reaction, your initial thoughts.
So H.R. 1, which most people commonly have heard it referred to as the One Big Beautiful Bill, was passed and signed July 4th, and it has drastic cuts, historic cuts to Medicaid from the federal funding level, which has direct state budget impacts and impacts to Medicaid beneficiaries here in Arizona, as well as the healthcare providers in the state. So the current assessment is right now healthcare leaders are trying to figure out what exactly is in the bill, what does it mean, what will the impacts be? Will things change, right? The political winds. So we know there's a storm coming. Actually, we're in the storm. We're just not sure how bad it's going to be. So we're just trying to do the best we can to navigate through these difficult circumstances to continue to provide care to Arizonans.
What do you know that specifically that will for sure impact hospitals in Arizona?
Should all of these provisions go into effect, and we have to believe that they will, we know for sure that there are going to be stricter requirements for Medicaid eligibility, work requirements, shortened timeframes for redeterminations, really a lot more red tape and bureaucracy added to the process for those who are eligible to remain on Medicaid. Also, what we know as part of the bill is a reduction in what are called provider taxes. Those are critical funding mechanisms that the state of Arizona in particular, like many other states, use in order to draw down that Medicaid funding from the federal government to pay providers for the services they provide to Medicaid beneficiaries. So we know there are going to be a loss of annually billions of dollars to providers, and the state will have to make some difficult assessments and decisions on what they want to do in that regard.
Now, correct me if I'm wrong, the matching rate to expansion was hit, wasn't hit? I know there's a 90% match here. Is that what you were referring to, or where does that play into all this?
No, actually, the FMAP, that's the federal match for the states, for the expansion population, actually did not change in the bill.
Okay, it didn't.
There were promises made to senators and others that they will revisit that. So we expect that to be back on the table. However, as passed, H.R. 1 did not change the FMAP for the expansion. What it did was put in stricter requirements for eligibility and reduce provider payments.
And again, I hear from those who support the bill, and they say that Medicaid enrollment doesn't necessarily need to go down. It will not. It's not a cut, as it were. But what we're hearing from the other side is that, you have to check that. What they're saying from the other side is you still qualify. You just got to prove it. And what you're saying is proving it is such a deterrent to so many people, they're just going to fall off?
And you're exactly right. As the bill's written on its face, it doesn't seem like they are disenrolling anyone or taking anyone off the Medicaid rolls. But we know by these increased requirements, and we're not against work requirements per se. No one is really, but they're not understanding the administrative burdens is really what they've done. It's a thinly veiled way to actually add more bureaucracy, more layers to make it for those folks who are eligible to fall off. And I think what people don't realize is Medicaid isn't like Social Security, where you're just sitting there, like they say, able-bodied adults collecting paychecks, collecting a check for Medicaid. That's not how our system works. Providers get paid for providing services to Medicaid patients who come in and need those services. So really what we're going to see, in order to realize the cost savings that they needed in this bill to get the tax cuts that they wanted, ultimately you're going to have to serve fewer people. So we know that will happen. But they have been very good in the rhetoric of we haven't cut anyone off, we're addressing fraud, waste, and abuse, but ultimately no, to achieve those cost savings, people will have to fall off the rolls, or providers will have to be reimbursed lower rates.
Yeah, it's an interesting equation there. What happens, I'm hearing a lot about rural hospitals in real trouble if and when all these things go through. Is that hyperbole? Is it reality? What's going on here?
The reality is hospitals, both urban and rural, have really tight financial margins. You know, they have to be very, very conscientious and smart with their business operations, and rural in particular, because maybe not the volume or the populations they serve. There's a heavy Medicaid population in rural areas, so they will definitely feel a lot of these cuts directly and quick.
Yeah, and I remember years ago, before we had the expansion and all this going on, uncompensated
Yep.
care from hospitals was a big deal. We had a lot of hospital executives on here saying, we can't survive with this uncompensated care. Something's got to be compensated. Are we going back to that?
Well, and that's the thing, Ted. This isn't our first rodeo. We've seen this story play out. I was actually at the Arizona Chamber of Commerce at the time, and I worked for them when the Arizona Chamber was a huge proponent with Governor Brewer of expanding Medicaid to eliminate what they called the hidden health care tax on business and to lower uncompensated care. Because by law, hospitals have to serve everyone that comes into their doors for service, regardless of their ability to pay. So if they can't get reimbursed for the services they've rendered, they can't bear those costs. So there's cost shift in the system, and often that has to go to employer-sponsored or private insurance in order for hospitals to keep their doors open.
In order to keep those doors open, but again...
For everyone, not just Medicaid patients, right?
Right.
We have an integrated healthcare system. We don't have Medicaid hospitals. We don't have Medicare hospitals.
Right.
We don't have private insured hospitals. We're all one big system, and Medicaid is a huge component of that system. So when you start to cut the financing and mess with that, it really destabilizes the whole entire delivery system.
To the point that hospitals might have to close their doors.
Potentially. I mean, worst case scenario, yeah, it's a real threat.
It sounds like it won't take effect till the end of next year, correct?
They're depending on which provision,
Yes, I guess they're
different
floating.
effective dates, whether that be to get by the parliamentarian, whether that be for administrative reasons or political, but various effective dates.
So last question. We talked about what happened, I think, in 2011 or back when was it, somewhere around there, 2012?
The freeze happened during the Great Recession.
Right.
So we saw that here. So Arizona, what we have, we're unique other than other states. We have, our expansion population is really made up of two different avenues. It's Prop 204, which was passed in 2000 by the voters saying they wanted low-income folks to receive Medicaid benefits. Governor Brewer, after the Affordable Care Act, knew that they could expand just slightly to draw down more federal funds, cover more people, and deal with that uncompensated care cost that the hospitals and the business sector really had felt when they froze enrollments during the Great Recession. When we saw the enrollments freeze in the Great Recession, what immediately happened was uncompensated care spikes. What happens when people lose coverage? They don't stop getting sick. They just don't seek the appropriate care at the appropriate time, and they come to the ER sicker
Right.
and more expensive care.
So last question, really quickly. Were lessons learned there that can be applied here?
Yes, and this is what we kept saying. We've been here before. We've seen this story play out, and it didn't go well. It didn't go well for Arizona, and this is exactly what you'll see in other states. Unfortunately, I don't think that resonated the way we hoped it would, and the bill passed, and so we're not making this up. It's not hyperbole. We have been here before.
Yeah. Brittany Kaufman, again, Health System Alliance of Arizona. Really good information. Good to have you here. Thank you.
Thank you for the opportunity. Appreciate it.
You bet.